The next section of this chapter focuses on blood pressure, and before we can talk all about blood pressure, we need to talk about a few terms that are going to be important. Blood supply to the tissue can be expressed in terms of flow and perfusion. So we've talked about flow a little bit, the amount of blood flowing through an organ or a tissue or a blood vessel. So maybe could be measured in milliliters per minute or similar unit, whereas perfusion is the flow per given volume or mass of a tissue in a given time. So that's a little bit different, and that's going to vary organ to organ or tissue to tissue. At rest, the total flow is pretty constant. It's equal to the cardiac output, which is on average 5.25 liters per minute. We know that the blood is bringing all of the nutrients, especially oxygen, to all of the tissues, but more importantly, removing all of the waste from all of the tissues. And so it is important that it does not dilly-dally and gets everywhere it needs to be. The equation right there is for blood flow is based on pressure and resistance. And don't let this equation scare you. It's basically things that make sense. You would expect a difference in pressure and the resistance to the flow to have an effect on the flow. So if we're looking at this, if the pressure increases or there's a greater pressure difference between 2 points, then the flow is going to be greater. Think about something going downhill. And then if there's a greater resistance, then the flow is going to lessen. That makes sense too. So blood pressure itself is the force that blood exerts against a vessel wall. So we've talked about that in arteries. This blood pressure is much higher than it would be in veins. It's usually measured at the brachial artery using the sphygmomanometer, which is a blood pressure cuff. And we measure two pressures. The systolic pressure is the peak arterial blood pressure taken during the contraction of the ventricles, and then the diastolic pressure, which is the minimum arterial blood pressure taken while the ventricles are relaxing in between heartbeats. So normal young adult would be 120/75. The pulse pressure is the difference between those two pressures, the systolic and the diastolic pressure. And we would measure this of stress exerted on small arteries when the pressure surges generated by the heart. You can also measure the mean arterial pressure, or the MAP. That would be taking measurements at frequent intervals throughout the cardiac cycle. So these two were mentioned earlier in the heart chapter, and I thought that they were a weird bit out of place, and so now I see why I felt that way. So high blood pressure is called hypertension, and it's if your resting blood pressure is 140/90. This can weaken the small arteries and cause aneurysms. This was in the heart lecture where we talked about how an aneurysm can occur. Low blood pressure is hypotension. This can be caused by blood loss, dehydration, or anemia. One of the reasons that our arteries are able to withstand this blood pressure is because they are able to stretch and recoil during the cardiac cycle. We've kind of talked about the anatomy of the artery, but that elasticity helps maintain a steady flow of blood throughout the cardiac cycle and kind of smooths out pressure fluctuations, so decreases the stress on the smaller arteries. We expect blood pressure to rise with age because the arteries absorb less force, and we would expect the blood pressure to be determined by cardiac output, the blood volume, and then the peripheral resistance, and we're going to define those. Peripheral resistance we've talked a little bit about, but not really. It is the opposition to the flow that the blood encounters in the blood vessels. So this resistance has to do with three different variables: the thickness of the blood, or the blood viscosity. Again, this is going to make more sense when we look at the makeup of blood and talk about red blood cells and the proteins in there. So this may not all make a ton of sense until we go through the blood, but The thickness of the blood has to do with how many red blood cells there are, and then the concentration of a protein called albumin. The vessel length, if the farther the liquid travels through a tube, the more cumulative friction it encounters. So that would be an increase in resistance. And then pressure and flow are also declining with distance. And then the third factor for peripheral resistance is the vessel radius. So that has the most powerful influence over the flow of the blood, the size of the vessel. It is a significant way to control that peripheral resistance. And then if we're talking about a vessel getting narrower, we'll use the term vasoconstriction. It's when the smooth muscle is contracting, and that makes the vessel narrower. We talked a little bit about this during capillaries. And then the opposite of that, the relaxation, allowing the muscle or the vessel, to get wider. That's called vasodilation. I'm going to skip through a little bit of this, and I just want to touch on a few more things, but we're going to have to shorten this section up a little bit. From the aorta to the capillaries, the speed of the blood is going to decrease. And again, we've talked about this a little bit in the artery section, but it's going to decrease because it has a greater distance. More friction is reducing the speed. The smaller radii of the arterioles and the capillaries offers more resistance, and it's farther from the heart. That's probably the most obvious reason. The number of vessels in their total area become greater and greater. So think about going from a big aorta into thousands of tiny little capillaries, and so that's definitely going to slow the blood down. And then going the other direction from the capillaries to the vena cava, the flow is going to increase again. You can think about kind of tributaries draining into a big river. There's decreased resistance going from capillaries to veins because they're flowing into each other. A larger amount of blood forced into smaller channels. But it doesn't ever get back up to the velocity that it had in the large arteries. Arterioles have the most significant point of control over peripheral resistance and flow. So it's about the half of the total peripheral resistance. And remember, that's when an artery is branching into arterioles, those smaller arteries. Okay, so I'm going to jump forward to the part where it talks about negative feedback on blood pressure. You should definitely read through this local control and neural control, but we've already talked a little bit about cells that are sending messages back to the brain about blood pressure, so I'm going to fast forward here a little bit. But I would definitely look through and watch these animations that are included in this set of notes. But I like this picture right here. I think this kind of showcases what the body does as far as homeostasis, as far as negative feedback, what happens when there's elevated blood pressure and when there's reduced blood pressure. What exactly is the response? So this kind of showcases that whole feedback loop as far as when there's elevated blood pressure and then when there's reduced blood pressure. I would also look through that animation. And then this talks about the list of hormones that affect blood pressure. And to be honest, until you've had an extensive endocrine system chapter, I'm not sure that this is going to be a whole lot of helpful information. So I'm going to just make sure that there's anything else as far as blood pressure that I want to include or focus on. And I do not think there is. I think that's it. I like this picture too. This shows a little bit about constriction or dilation and how that can increase and decrease flow. So I'm going to leave the blood pressure section here. We've got one more section about actual transport in the capillaries, and then another section of this chapter about the venous return, or the blood filtering back through the veins.